Nurses at Cottage Hospital's emergency room are trying to educate patients on what to do if they do test positive for COVID. News Channel 3's Scott Sheehan spoke with a nurse today about their triage program.
Okay. Santa Barbara emergency room nurses are surprised 8 months into the COVID-19 pandemic how little their patients know about the virus after testing positive.
A lot of times when I called them, it was almost like somebody was talking to them about it for the first time, because for the layperson who's not a medical person, it's just so overwhelming to get this kind of information.
Cottage Hospital set up a nurse unit in July to help patients quarantine and care for themselves at home. Nurses are also giving out COVID kits with a thermometer, oxygen level monitor, and contact information for a nurse in case they have any questions. Shannon Cook is one of those nurses. She says those kits have already saved lives, alerting people their oxygen levels were too low.
So they texted me a picture and I said, oh, it's 88 and he's breathing funny, you need to get him in right away. And we brought him in and he ended up being admitted for respiratory distress, and he was hospitalized for several days.
Cook recommends those who test positive to call their doctor and follow guidelines from the Center for Disease Control. Experts say people need to quarantine for 10 days from the time of their first symptoms or from when they first took their test. Then people need to go at least 24 hours with no fever.
You've been fever-free for that 24 hours without the use of fever-reducing meds, that you're no longer considered contagious, or that your viral load is so minimal that you're not considered contagious anymore.
Cook says everyone, including those who have recovered from COVID, should keep wearing their masks and washing their hands. For more information about where to get a test or what to do if you test positive, visit this store in our mobile app and website. In Santa Barbara, Scott Sheehan, News Channel 3.